Hello and Assalamu alaikum, Ultra Scan Diagnostics. Here, this is the CBCT of the patient that you had requested. The area of interest is the lower right and the lower left wisdom tooth and their association with the inferior alveolar nerve. On the panoramic view, you can very clearly see that the inferior alveolar nerve is in close proximation to both the wisdom teeth. On the transaxial view, which is the proximal view, this is the 7 as you're moving to the 8. So this is the lower right 8. The lower right 8 has its wisdom tooth apex very close. The orange part denotes the inferior alveolar nerve. We're going to zoom in for our kind doctors. And this is where the lower right 8 comes in very close approximation to the inferior alveolar nerve. The tooth is lingual and the inferior alveolar nerve is placed buccally. We're going to remove the highlights to get a better idea. So this is where the tooth is, and this is where the inferior alveolar nerve. It is not compressing. It is very close. However, it is not compressing the inferior alveolar nerve. We've got a slight bit of a dilaceration developmental defect on the lower right 8. The apex does not seem to be it does seem to be completely closed, but we have this extension from the root of the lower right wisdom tooth, which could be a cause of concern during extraction. But the inferior alveolar nerve on the lower right hand side does not get compressed or does not get in complete contact with the inferior alveolar nerve, with the wisdom tooth on the lower right hand side. There is a chance for damage when the tooth is extracted, but if done skillfully, there is a very high likelihood that the nerve will not get damaged. This is the wisdom tooth on the lower left hand side. So this is the crown portion. This is the inferior alveolar nerve. This is the root portion. As you can see that again there's a little bit of a curvature in the root. This is the apex of the distal root, and you can see that it is quite significantly away from the inferior alveolar nerve, and 2.7 millimeters. The inferior alveolar nerve is buccally placed. The wisdom tooth is on the lingual aspect, but it is not in contact, and this wisdom tooth extraction should go uneventfully without any damage to the inferior alveolar nerve. On the axial view, which is the top to bottom view, this is the right hand side, this is the left hand side. As we move from the crown portion towards down to the apical portion, here is where you can see the right hand side, the inferior alveolar nerve comes closely in association with the lower right wisdom tooth. But on the lower left hand side, you can very clearly see that the inferior alveolar nerve does not come in close association to the wisdom tooth on the lower left hand side. So if you have any further questions, please feel free to reach to our team. We would be extremely happy to help. Just to give you an idea of the sagittal view, which is basically the side to side view. On the sagittal view, you will be able to appreciate also this is the lower right hand side, and this is how it looks on the sagittal view, and this is where it comes very close in contact, in close association right there. So this is the lower right hand side. We're going to show you the lower left hand side, and that's right here. So this is the lower left wisdom tooth right there, and there we go. So the lower left wisdom tooth is right here, and this is where the inferior alveolar nerve is. So hence it is not very closely associated with it. Thank you very much.